Hello. Recently at my birthday party, the topic of vaginas and the pelvic floor came up because that is just who I am. And as a result, we started talking about vaginal estrogen, and a lot of people at the party didn't know what it is. And so I figured if they didn't know, a lot of people out here might not know. So let's talk about it. First, let's talk about some anatomy. So if we're looking at the pelvis, here is the front, your pubic bone. So if we're looking at the external genitalia, the skin has been removed here. Everything that's red is muscle. So these are part of the pelvic floor muscles. And then this is the clitoris, or the part of the clitoris we can see. Here's the urethra, vaginal opening, and the anus. All of this mauve colored tissue, including the urethra, all of this depends on estrogen to stay happy and healthy. If you have ovaries, as we age, our estrogen levels are slowly going down. As a result, this tissue is no longer getting what it needs to stay happy and healthy. Some people may not experience any symptoms, but other people may start to experience things like dryness, leaking, getting frequent UTIs, having pain with penetrative sex. A lot of different things can happen, but one of the treatment options, there are many, but this is just one, is to use something called localized vaginal estrogen. It is a cream that you can apply directly into this tissue to help supplement it, and that can then help decrease a lot of symptoms like leaking, dryness, pain. It can also help prevent urinary tract infections. So that is something that if you're having those symptoms and you're in perimenopause or menopause, it might be a good idea to go talk to your gynecologist to see if it would be an appropriate treatment for you. As a pelvic floor therapist, I cannot prescribe this. I can only educate people about this anatomy and how hormones affect it and treatment options that might be appropriate. Might not be appropriate for you, but it's still important to understand and know these options so then you can have an informed conversation with your doctor.